When patients turn 18, they become a full-fledged adult with rights and responsibilities. They are now capable of making their own decisions, and they are legally responsible for their actions. Once a patient with intellectual or developmental disabilities, or IDD, turns 18, they may have an appointed guardian that is responsible for their overall well-being. Patient guardian information will be available in their medical record. If it is not, please alert the IDD nurse navigator so that it can be updated. Most IDD patients will almost always be accompanied by a guardian, caregiver, or other support professional. While all of these individuals can provide valuable insight into the patient's communication style or behavior, not all of them can make medical decisions for the patient. It's important to understand if the person accompanying the patient is their legal guardian or if they are support staff. If they are the legal guardian, they must present proof of this in the form of a legal document that's been signed by the court. This would be put on file in the patient's medical record under the Media tab. If they're not the legal guardian or next of kin, they must have proof in writing that they are authorized to make medical decisions on the patient's behalf, such as signing consent forms. For example, a patient coming from a care facility may be accompanied by support staff. The support staff would need to bring documentation stating that they can act on the patient's behalf. If this documentation is not available, the appointment should be rescheduled until a guardian can be present or proper documentation can be shown. However, for follow-up visits, where no procedure is being done, a new consent is not required. Also, in some cases, verbal consent may be obtained from the guardian by telephone. In these cases, contact your supervisor or a transitional navigator for guidance.